in the world to go if it's serious. And that's the Cleveland Clinic. Why? Because it's worth schlepping up to Cleveland, Ohio. And I live in Southern California. It's worth going up there if you've got something that's intricate and tricky because you want to go to the very best. You want to go to the place where they do 100 open heart operations a day versus most institutions might do 5 or 10 or maybe 15. You want to go to the place that knows it all. So the Cleveland Clinic, when you go up there, and I went to Case Western Reserve University Hospitals for part of my training, which is in Cleveland. So I spent some time at the Cleveland Clinic as a fellow and as a resident. And I tell you, when you go there, it's like going to the United Nations. There are people from all over the world in all kinds of dress, speaking all kinds of languages. Why did they all come to the Cleveland Clinic? Because if you've got a tricky heart problem, that's the place to go. And these people understand that that's where you want to go. So with that introduction to the quality, by the way, I've got no financial interest at all in Cleveland Clinic. I just want to tell you that it's great. So in this month's Cleveland Clinic cardiology newsletter, it talks about antioxidants. So let me just read some of this because it's really just apropos. Whether you realize it or not, there's an ongoing battle in your body. Free radicals, a byproduct of cellular metabolism, ravage healthy cells. That's what I was talking about. Death of cells is aging, accelerated aging. So Eternal decreases the death of cells. Anyway, so free radicals destroy healthy cells, seeking to destroy them and opening the door to a host of diseases. A free radical is an atom with an unpaired electron that's formed when oxygen binds with another molecule. Because a lone electron is unstable, it will latch onto another cell and kidnap an electron, destroying the cell in the process. In other words, free radicals kill our cells. So antioxidants fight and destroy free radicals. So what happens is free radicals will build up and it causes something in our body called oxidative stress. So what does that do? Well, oxidative stress damages, but I'm reading from the Cleveland Clinic Heart newsletter, the lining of arteries, causing inflammation and inviting plaque to accumulate in artery walls. It also reduces the pliability of blood vessels, in other words, how flexible they are, making them stiff. This impairs circulation, increases the heart's workload. In general, oxidative stress causes systemic inflammation. There's that word inflammation again. This is when we see disease. When inflammation goes up, we start seeing disease start popping up. Coronary artery disease, diabetes, high blood pressure, Alzheimer's, all kinds of autoimmune diseases, all kinds of cancers, all kinds of things like Hashimoto's thyroiditis and fibromyalgia. All of it caused because we have, in part, because we have too many free radicals and oxidative stress. So basically, what you want to do is take antioxidants. Antioxidants can be vitamins, minerals, flavonoids, and enzymes. There are hundreds of types. Well, the antioxidants we have, CoQ10, resveratrol, and glutathione, are also effective, but they're not food antioxidants. Now, I want to tell you the honest truth because you're going to hear from skeptics about this. So it's better you hear it from me and you know what the facts are. So when somebody starts nagging on you, when you start telling them about antioxidants and how important it is to take Eternal, and they come back with this, you know how to answer it. So listen to this. This is from Cleveland Clinic Cardiology Newsletter. Quote, no antioxidant vitamin supplements, including vitamin C, E, lower heart disease risk. Let me read that again. No antioxidant vitamin supplements, including vitamin C and E, lower heart disease risk. These vitamins have been extensively studied and have shown no cardiovascular benefit. What the Cleveland Clinic is saying is that it's the antioxidants in foods, not in supplements, in terms of coronary artery disease and heart disease. Well, yes, that is true. However, We're talking about all kinds of bad diseases that have nothing to do with heart disease. We're talking about cancer. We're talking about diabetes. We're talking about autoimmune disease. We're talking about Alzheimer's. We're talking about dementia. We're talking about Hashimoto's thyroiditis. And nobody knows for sure at this point whether or not that the same limitation occurs with supplements such as ours and those kinds of diseases. So until more studies are done and the jury is out, please do yourself a favor and get on Eternal, because it's a fabulous collection of antioxidants to lower free radicals. And I don't want to have you say, oh, well, because there's no proof it works for coronary artery disease, therefore I'm not going to take it. And now we find out 5 years later, after you've gotten your cancer, or after you've gotten your autoimmune disease, or after you've gotten your fibromyalgia, that now studies are showing that, guess what? Glutathione, resveratrol, and CoQ10 are powerful in terms of helping to reduce these bad results of having too many free radicals in your system. So the reason I want to mention this is because you may talk to somebody who says, oh, hogwash, it's been shown that no antioxidant in supplement form helps in terms of coronary artery disease. Yes, that's what Cleveland Clinic is saying. What I'm telling you, though, is there's a whole host of other things that haven't been studied yet. And until some studies are there, believe me, it's worth it for you to take a preventive approach and be on this product called Eternal. The other exciting thing I wanted to share with you very quickly, because the hour is late. So let me just pull up some of my things for you. Okay, so I subscribe to the New England Journal of Medicine. For those of you that don't know, the New England Journal of Medicine is one of the world's premier medical journals. And if your physician is not keeping up on his or her medical education, encourage them to do that. So here's an article from the June 1st Journal Watch of the New England Journal of Medicine. GLP receptor agonists for metabolic dysfunction-associated steatohepatitis. Many of you have heard of something called fatty liver. In fact, you may even have a fatty liver yourself. We often pick it up by feeling the belly, and lo and behold, there's the liver edge. It's a little bit depressed under the right costal margin, the right rib cage, and we send you for an abdominal ultrasound. Abdominal ultrasound is nothing more than what women get when they're pregnant. We do pelvic ultrasounds on the uterus to see the babies, or cardiac ultrasounds, where now we bounce sound waves into the heart to see about ejection fractions and how your heart valves are doing. So we do the same thing for the belly. We're looking for the size of your liver, and lo and behold, we find you've got a fatty liver. It's very common. It's called MASH. Okay, metabolic dysfunctional associated steatohepatitis, MASH, M-A-S-H, otherwise known as fatty liver. Now, what do we do about it? At this point, nothing. However, more studies are coming out that's showing maybe we should be more aggressive in trying to lower the amount of fat in liver, because it increases the risk of liver cancer many, many, many years down the pike. Well, here's an article that showed that the old GLP-1, and again, why is this apropos for us? Because Dr. Dan has shown that Vitalite and Revive increase the metabolic activity, the expression, they upregulate the GLP-1 gene. So basically we turn it on. And what this article is talking about is that there are now some studies that show that if you use some of these GLP-1 products like Ozempic and Wegovy and Zepbound, that you can decrease the chances that people are going to have problems with their liver. So listen to the bottom line here. The comment is, this study ultimately will include 1,200 patients that will be followed for 5 years to examine a clinical and not simply histological endpoint, cirrhosis-free survival. In other words, we've got to look over the next 5 years at this 1,200 people in the study to see how many of them develop cirrhosis and how many don't. But the point is, just the fact that there's enough evidence that maybe GLP-1 will do a good job in terms of helping people who have fatty liver All I can say is stay tuned. All right. The next thing is here's an article that says GLP agonists improve walking function in patients with peripheral artery disease with claudication. Many of you may be aware that we have a process called arteriosclerosis, or I call it sludge in the pipes, that occurs in our body as we get older. If we get carotid sludge in our carotid artery going up to the neck, it blocks off oxygen flow and we can have a stroke. If we get clogged up coronary artery disease, it's called coronary artery disease, and that can lead to heart attack and congestive heart failure. So what do? We do roto-rooter. We do endarterectomy, if you will, where we clean out the carotid arteries and we basically open up those carotids so more oxygen can get up to the brain. We do angioplasty in the coronary arteries, or if you've got too much sludge in too many places in your coronary arteries and you can't easily open it up with roto-rooter or angioplasty, and then put in what's called a stent. A stent is nothing more than a little spring. For those of you old enough to remember ballpoint pens, just if you undid the pen, you'd find this little spring in the pen. That's what a stent is. We put one of those in the coronary arteries to basically keep the coronary artery open. This is after we do roto-rooter to clean out the sludge in the first place. Well, if we develop if we develop arteriosclerosis, or hardening of the arteries, in the arteries going down past our groin and into our legs, that's called peripheral vascular disease, or peripheral arterial disease, PAD. And what happens? As we walk, we get pain in our calves, and we have to stop and we have to rest for a few minutes. And as we're resting, what's happening is we're getting more blood flow down to the muscles in our calves so we can continue walking. And you walk for another block or two, and then the same thing happens. You get pain in the calf. You have to stop and rest. That stopping and starting and stopping and starting is called intermittent claudication, which means that as you exercise, as you walk slowly, you're not getting enough oxygen down to the muscles in your calves, and that's what's causing the pain. So what's being shown? It's now being shown that GLP-1 agents like Ozempic and Wegovy and Zepbound are showing increases in the ability of people to walk. In other words, they can walk further using these products. Now, why is this happening? They don't know. They don't think it's related to weight loss, because in the studies they have shown people who have been given the Ozempic or the semaglutides or the GLP-1 agonists, and in the control groups where they get basically sugar water, there's no difference in the amount of weight. So it's not a weight loss thing that's causing the improvement in your ability to walk. It must be something that the GLP stimulant drug is doing. So that's exciting, because I would love to see down the road Dr. Dan do some research and find out that our Vitality and Revive, because it basically turns on GLP-1 genes, also is good for people who have peripheral vascular disease. So listen to this comment. Based on mounting evidence that glucagon-like peptides, this GLP-1 receptor agonist, prevent vascular inflammation, researchers tested semaglutide in this setting. And again, the small difference in weight loss in this trial suggests that there's a direct vascular benefit from the GLP-1 on the arteries, and it's not because of weight loss. Now, again, I don't want anybody to get off this phone and go crowing that, oh, we've got this drug that helps peripheral artery disease. Not drug, we've got this supplement. No. I'm just giving you what's cutting edge first clinical science to tell you basically to stay tuned. Now, the next thing I want to point out from the Journal Watch from June 1st, volume 45, is a wonderful article on more evidence that viral infections can be a trigger for dementia. Viral infections can be a trigger for dementia. And this study talked about people who get herpes virus and COVID virus. Now, herpes, you may be aware there's two types of herpes, herpes simplex type 1, and also that there is herpes zoster, which causes shingles. Well, in this study, people who had herpes simplex type 1, herpes zoster, and also COVID were basically at bigger risk for developing Alzheimer's. So, why is this important to us? Well, why do you think we want to be on immune? We want to be on immune to decrease our chances that a virus like herpes simplex 1 or zoster or COVID is going to come along and do a number on us. Remember, the immune doesn't necessarily prevent you from getting sick, but it's the same rationale as taking a flu shot. I tell all of my patients, you've got to take a flu shot. Why? It won't necessarily prevent you from getting the flu, but if you get it, it's going to be much milder. Well, the same thing here. If we've got evidence that viral infections can trigger dementia, please think about staying on immune. Anyway, I'm going to wrap it up from there. And I just want to tell you, it's been a pleasure to talk with all of you and to share some of this exciting stuff. I hope I didn't wear you out. My wife's not home tonight, so she doesn't know I've gone 2 hours, but I'm having
Okay. Well, thank you, Bob. Thank you, Dr. Bob. Thank you so much.
Okay.
Yeah.
Thank you. Long,
Thank
but
you, Dr.
very
Bob.
knowledgeable. Great, great, great presentation.
Well, you can present the business, but I love the products. And after all, Christine, I got to tell you again, if the products weren't as great as they are, this whole thing would have fallen apart long ago.
Absolutely.
I mean,
to live to 100.
You got it.
Enjoy life.
You got it, babe. Forget about 93. Let's get to 100.
Okay.
Anyway,
have a great evening.
Thank you. And folks,
Thank you, Dr. Bob.
I do this marathon every Monday night at 7 o'clock.